This video draws on the experience of 4 RCCE specialists who worked in West Africa during the 2014-2016 Ebola outbreak. They will give you their top tips on how to do RCCE in public health emergencies. It is about systematic engagement and dialogue with the communities and the people, about behaviors that support stopping or preventing the spread of an infectious disease.
But the question is, what will make people take action? It's all about risk perception. 2 things have to happen. 1, people must believe that they are at high risk of catching this virus and that it could have severe consequences for them. And the second is, they have to believe that the recommended actions will work and it will protect them from this coronavirus. Why should people believe in the information and the messages that we're giving them and the things that we're asking them to do? Why should they believe us? This is a question of trust. Trust is built up of 2 things: trust in our motives and trust in our competence. People have to believe that our motives are clean and it is only their own interests that we have in mind. This calls for transparency. This calls for empathy with their situation. This community engagement primarily means listening to people. While we are putting out messages, we are putting out information on the actions that people can take, we need to get feedback from communities on what they think about the information that we're giving them and the health protection messages we're giving them. We need to have their opinions, their thinking, their own suggestions on how things can be done to stop that epidemic.
Communities should be at the center of a response. Consult with the right leaders and local society groups before, during and after an emergency. Allow space for people's own ideas and suggestions and try to support local initiatives. Communicate so people can understand you. Some people can only understand their local language, others can't read or write, and others may prefer songs or video over written text. Find out what your audience needs, including which people are most trusted in the community.
So my number 1 advice is, if you want to build trust with people, and you must build trust in order to change behaviour, be honest and authentic and straightforward, even if it means admitting that you don't know something, or even if being honest doesn't make you look particularly good or make the person feel, as good as they could. Always be honest as your number 1 priority. Be empathic. Listen to people more than you talk to them, especially at first. Understand people's emotional responses to the outbreak. Listen to what their beliefs are about the situation, what their priorities are. And only once you get a sense of where they're at, do you start to insert those bits of information into the conversation that you have, and emphasize all of the things that they can do and that they are doing to bring the disease under control. Ultimately, it will be the community that determines whether or not and when we get COVID-19 under control. So really amplify those positive kind of empowering aspects. I think that's more effective than appealing to fear ultimately.
It is very important that you follow all the infection prevention and control measures for the different type of activities, including for the work that you will be doing on risk communication and community engagement, and especially if you're doing it in person. And that is to ensure your safety and the safety of others.
So, to recap, in order to do RCCE, well, you should build up on a trustful relationship, listen to people and act on their ideas, involve the right local leaders, communicate so people can understand, show solidarity and support, be honest and transparent, use positive and can-do messages, ensure that you follow safety measures at all times.